Hey everyone, this is Danny Urbina, health insurance specialist, and today we're going to be talking about subsidies. I saw a little fact in Kaiser News that said of the 10.6 million Americans who have health insurance through the ACA, 87% of them qualified for a government subsidy. And that's a huge percentage. But a lot of people don't know how subsidies work, how to use it to your advantage, or how it can actually hurt you. So a subsidy is a tax credit, or you can think of it as a discount for your health insurance premiums. And to qualify for a subsidy, your income threshold needs to be between 100 and 400% of the federal poverty line. So to give you an example, that's around $48,000 or less for an individual, $65,000 or less for a couple, and for a family of four, that's roughly $100,000 or less. So let's give an example. Let's say you're self-employed in your 30s and you have to pay for your own health insurance. Your employer doesn't give it. So if you're going to make roughly $35,000 your first year, well, you'd actually qualify for a subsidy. So you could potentially qualify for a $300 a month subsidy depending what state you're in. So when it's time to buy health insurance, if you want to buy a plan that's $400, you're actually only going to pay $100 for that exact plan. But let's say you have a kick-ass year your first year and you do a lot better than you think you're going to do. And let's say you make $55,000. Well, that's above the $48,000 threshold. So at the end of the year on your taxes the next year, you're actually going to have to pay that money back. That's a huge check you have to write back for your health insurance. So you need to make sure you're not going to out-earn your subsidy if you do. Okay? A lot of people don't know how they can see if they can qualify for a subsidy. So I'm going to show you where to go and to see if you can qualify. This is a public website, so I definitely encourage you to go check this out. But I'm going to put my zip code here in Sarasota, Florida, and we're going to see how subsidies actually look when you're on the website. So I'm going to do who's in your house. I'm going to do 2 people in this situation. No kids. And I'm going to put some ages in here. So let's say I'm 32, and I have a lovely wife who is 20. We'll do 28, a little bit younger. What do you think your household income is going to be in 2019? So I'm going to do a nice moderate income of $80,000 for the 2 of us. So there's no subsidy given, okay? No subsidy. So the cheapest plans on the marketplace, the options for me with no subsidy looks like 601, okay? So let's say I have an off year where I think I'm going to make a lot less. Let's say I think I'm going to make $56,000. Me and my girl combined. So 56, we would qualify for a $370 per month subsidy. Okay. So the same exact plan we were just looking at, instead of being 601, it's now $231. That's more than half the price cut in half. So this is a big difference. This is almost $4,000 per year. So you really want to put an accurate income, overestimate it if you can, to make sure you don't out-earn that subsidy. So now you know how subsidies work and how they can play a huge role in you and your family's expenses. I've talked to real estate agents in the past who literally had to think twice before selling a home, because if they did, they were going to have to pay back $10,000 in premiums for their subsidy at the end of the year. Now, if you're self-employed, you can use tax write-offs to your advantage, so I would definitely take advantage of that. Now, every 4 to 6 months, I would check your income and your write-offs to see where you stand in out-earning your subsidy. For a lot of people who don't want to worry about losing a subsidy, but the cheapest prices for the marketplace plans are a little too much, there are alternative options to the full price of a marketplace plan. Some options don't ask you any income-based questions, so you can get a health insurance plan and not have to worry about paying any money back. For any additional answers, ask Danny. You can reach me on my Facebook, my YouTube, or my Instagram pages in the descriptions below, and leave a comment to see what you want to hear about next.